We've got 4 cases in Maryland. That constitutes an outbreak, I understand.
Right.
So how concerned should people be?
Well, I think the general population, if you're vaccinated, if you have the full component of vaccines, should not be concerned at all. I think as a society, we need to be concerned as to what is going on in this country now, because we've had over the years a diminution among certain segments of the population in the percentage of people who are vaccinating their children. And when you get below a certain critical level, you get outbreaks, as we're seeing, serious outbreaks of hundreds of individuals, as we're seeing in the Williamsburg section of Brooklyn, in Rockland County. We saw that a little while ago in Washington State, in the Somali population in Minnesota. When you get below a certain critical level of vaccinating people for measles, which is such a highly contagious disease, then you get an outbreak. And when you get an outbreak, what happens is that people leave the outbreak area and then can spread it to those individual people who may not be directly in an outbreak area, but for one reason or other are either not vaccinated or under-vaccinated. That's how you get the individual cases that we're seeing in addition to the very large outbreaks. So yes, we need to be concerned about it as an individual person. If you've been vaccinated with the two components, namely one at age 12 to 15 months, one at age 4 to 6 years, then you're good to go. Some people have only had one vaccination, so if you're in an outbreak area, you need to see your physician about the advisability of getting the second shot, the booster shot. But for the most part, people who've been vaccinating their children who are vaccinated themselves are fine.